now, and I would like to introduce Professor Fernando Facio. Professor Fernando Facio is a professor of urology at the medical school in Brazil, specifically at the FAMERP. So I think that is the Faculty of Medicine of São José do Rio Preto, I think, if I'm getting it right. So he's also currently the medical director of the Men's Health Program. He's serving as chair of grants and prizes at the International Society of Sexual Medicine, and he is a treasurer of the Latin American Sexual Medicine Society. Professor Facio received his postdoc in sexual medicine by Johns Hopkins University, USA. He has more than 135 peer-reviewed publications and 250 citations. So welcome.
Thank you. Thank you, Marina. Thank you, Evie. Thank you, Francesca, to having me here. I will share my slides. It's here.
Great.
Okay, right.
Yes.
I'm very happy to share with you my lecture, Advances in Male Sexual Dysfunction. I have no conflict, and the proposal is to pay homage to Dr. Ariel Scafuri. As you know, he was a professor at the University of Ceará in Brazil. His legacy was friendship, loyalty. He worked hard with simple life and collaborate with a lot of science. Dr. Ariel will be missed by colleagues, friends, and family forever. The objectives today will be to understand limitations of currently available medications to treat ED, to reveal of potential enhancements to PDE5 inhibitor, to reveal of the alternative in the future pathways that may be potentially useful in ED management. As you know, in 1998, when I was launched Viagra, it changed a lot the treatment of our patients. However, many ED patients fail with PDE5 inhibitor due to, first, severe organic disease as diabetes, cardiovascular disease, radical pelvic surgery, especially in radical prostatectomy, nervous system lesions. Second, side effect profile. And third, treatment preference. Until today, we have some questions about functional outcomes. Have you really made progress? How can we improve our outcomes and restore normal organ function after radical prostatectomy? How can we improve ED treatment? Sorry. The conceptual framework, the classification of ED as mild, moderate, and severe. We know that a lot of patients respond using PDE5 inhibitor, but I have a new concept in the field, and I would like to bring up the regenerative medicine, especially to treat severe ED. The brief historical management of ED, Leonardo da Vinci, in the 15th century, describes increased blood flow to the penis as a cause of erection. In the 19th century, the American physician John King showed to us the first vacuum device. In the 20th century, in the 70s, the penile prosthesis became available. In the 80s, Dr. Virag discovered the proerective effect of papaverine, and the end at 90s, sildenafil become available as oral therapy. In the modern times, we use it a lot to treat it, our patients with different PDE5 inhibitors, but without true cure. Then the question is, do we have to look forward with shockwave, platelet-rich plasma, or stem cells? In 2016, Dr. Yaf, in his review article about new therapies in sexual medicine, about low-intensity shockwave, PRP, strobovascular fraction, amniotic fluid, and stem cells, all of them have indication to treat erectile dysfunction, Peyronie's disease, and penile enhancement. Shockwave therapy treated other medical conditions as orthopedics and cardiovascular disease, especially myocardial revascularization. And the brief evolution of lithotripsy and shockwave, in the 70s, we used it to treat it with high-intensity shockwave to treat stone fragmentation. In the 80s, in orthopedics, we used low-intensity shockwave to treat an inflammatory disease. In the 2000s, in cardiology, we use it to get angiogenesis. And the same idea and the same theory 10 years ago, we decided to use it, low-intensity shockwave, to treat ED. Shockwave is no-invasive and a promising method to treat regenerative medicine, inducing and activated new blood vessels grow, improving angiogenesis. We have some randomized controlled trials with initial data on experimental regenerative techniques. In this study, the patients who received shockwave in comparison with a placebo, these patients increased the IEF score and improved their erection function. The problem is, today in the market, we have a lot of numbers, different types of machines, and different protocols around the world. The new concept about regenerative medicine try to regenerate human cells, tissue, organs, or restore and establish normal function. Why use regenerative therapy? Ideally, stem cell can regenerate or replace damaged tissue with 100% functional tissue. And we can use autologous tissue to mitigate immune response. And better than this, each patient can provide their own cells. In this article, in animal model, Dr. Bevilacqua demonstrated that the use of gene therapy combined with PDE5 inhibitor in the group that used this kind of treatment in comparison with a control group or diabetes or monotherapy improve a lot the ICP. Where are you today? Where are we today? Biologics are a promising option, improving nerves, vascular, and smooth muscles function, either stabilizing the disease or reversing ED. How does it work? They initiate or enhance the body's natural healing properties to reverse disease and increase tissue regeneration. What is a biologic product? As vaccine, blood components, gene therapy, tissues, used to treat a variety of medical conditions for which no other treatment are available. What's the best approach for stem cells? Intravenous injections or direct and vascular bundle in the prostatectomy, or intravenous? What is a stem cell's action? A single cell that can replicate itself, differentiate in many cell types, and regenerate damaged tissues. The old concept was a building block. When implanted to a damaged tissue, stem cells differentiated to become the new building blocks of the rust tissue. The new concept is to promote and repair. When implanted to a damaged tissue, stem cells and neighboring cells secrete cytokines to build the new blood vessels, nerves, and repair damage. Despite limited human data until today, there is a growing interest in using stem cell therapy for treated erectile dysfunction. Today, we have more than 75 preclinical studies, 12 clinical trials in phase 1 and phase 2. Something about PRP. Where does it come from? The idea is to remove the peripheral blood sample, then after centrifugated, the PRP portion will remove it and will inject in the damaged tissues in the body, especially in the corpus cavernosus. In this article, with a small number of men with ED, the patients received an average 2 injections, and the results improved 4 points in IIF score. Something about a stromal vascular fraction. It's the same mechanisms to treat it, but in this treatment, it's necessary one surgical procedure to harvest tissue. Then this tissue will be centrifugated and the portion of SVF will remove it and could be injected in the damaged tissues. This article about SVF, published in European Urology, the authors demonstrated that the procedure is extremely safe, but the efficacy until today, it's not proved. In conclusion, current ED therapies do not provide a true cure for ED. The mechanism for how PRP, stem cells, and shockwave improve erectile function appear to be promising, and some initial studies have demonstrated benefit. The SMSNA believes that the use of shockwave, stem cells, and PRP is experimental and should be conducted under research protocols in compliance with institutional review board approval. Thank you for your attention and this important opportunity. Thank you.
So thank you so much, Fernando, for bringing us the old and the new concept in the treatment of male sexual dysfunction, and especially on ED. I think that this is very special for all our colleagues who can't have the opportunity to attend congresses or travel, and these are ideas that are that can stay in our mind and let us think what is possible and what is new in this field.